For over 3 decades, the minor's consent law has been an integral part of Minnesota's healthcare environment. But long-standing opposition to the legislation has recently gained enough momentum to seriously challenge the law. In fact, since 2004, there have been repeated attempts in the legislature to repeal minor's consent. These attacks caught some people off guard and brought forth a variety of strong opinions about the benefits of this piece of legislation.
I don't think that George Washington or James Madison or any of the other founding fathers risked their lives, their fortune, or their sacred honor to make sure that my 14-year-old daughter could have access to contraception. I just find that hard to believe.
Like people say, well, you pass out condoms, you know, that's giving the kids the okay to have sex. No, it's not. What I'm saying, though, is if you choose to be sexually active, then you need to protect yourself.
The folks who support minors' consent, who use it, have nothing to fight for. There's no apparent reason to believe that it's going to go away. The folks who want to weaken minors' consent in Minnesota are highly, highly motivated. And they've found a way to govern as a minority in this state.
Or is the law going to presume that the doctors are the best assistants to their children and therefore they're going to have all the information? I say parents, since they're the ones that are legally responsible, at a minimum, should be the ones that are legally presumed to have all the information, with an exception when parents have been proven not to be the best assistants to their children, and doctors should simply be considered to be assistants to parents.
Here we have a group of professionals that have all been trained to take care of teens. They devote their lives to taking care of teens. They stay up to date, they do the reading, they do the background stuff, and then they come right there to the door. And now we have some parents that are standing in front of the door and saying, no, I don't trust you to do that with my teenager.
If you are communicating or directing them in a way I believe is wrong and not in their best interest, can I trust you? If my daughter comes to you and you say, well, she doesn't want to talk to me and she wants to go on Norplan or something else, I mean, if you direct her that route, I don't think you're on my side. I think you're working against me.
This because I do this every day. That when I have a young man that walks in the front door and does not trust me, I deal with a community that is very distrustful of help and healthcare systems. If he cannot trust me to be an avenue between him and his parent, if there is a parent, then who else is he to trust?
You said it's about the duty of the parent and the duty of the physician. You didn't mention the duty of the child, and I think downplaying the duty of an adolescent or a teenager to make healthy decisions is undermining their intellectual ability, their ability to weigh their parents' influence, to weigh their doctor's influence, to weigh their peers' influence, to weigh the media's influence, and really balance those things and have a duty for themselves to be true to their own morals.
As I understand it, minors' consent is people who are under 18 are able to go seek confidential health services, maybe, you know, without their parents knowing, and it provides like a comfortable atmosphere for them between themselves and the doctor. And, you know, of course the doctors are able to step in and, you know, if it's a dangerous situation or something and involve the parents, but I think it really shelters people or provides a safe place to talk about health issues between the minor and the doctor. I can't think of many teens, many adolescents who wouldn't want this bill in place, who wouldn't want to be able to go to their doctor without their parents knowing for whatever reason. You know, to bring up issues of a friend, to bring up mental health issues, just to talk to maybe if their parents are working all day or don't, there isn't a good home situation.
I think that's, why teens are called minors, because we're not, like, grown up enough, we're not mature enough to make those decisions on our own. I think that, God gave you parents for a reason, and those should be your two main, sources, your two confidences. They should be your the people you go to, no matter if you screw up, no matter if you do really well, because, they went through things similar before, and they're the ones who love you the most and who you should be able to trust. I mean, I understand there's families, that have broken that trust and broken those bonds of communication, but in all reality, wouldn't you trust your parents more than you trust some doctor or practitioner that you just met?
Well, I know, like deep down, I know I could talk to my parents about anything that I needed to, and they'll always be there for me. It's still kind of scary to go up to them and be like, so I messed up, especially if it's something that I feel like I can handle myself or isn't even necessarily correct. And so I think this law applies to me by my being able to go to the doctor myself and talking to the doctor first before I presented it to my parents, or having help in presenting it to my parents.
I think that if you're going to keep information such as health information or things like that, it will definitely put a wedge between you and your parents. If I was to keep something like going to a doctor or an illness or anything like that from my parents, and trying to keep that a secret and things like that, or even just knowing that I'm going through this and she doesn't know, would definitely bother me.
Minor's consent to me has never been something like permission to work outside of families. It's been permission for me to start the conversation with kids, to find out what's going on in their lives, and to do it telling them, look, this is a private conversation. I'm here to help you. I'm another concerned adult. Let's figure out what we can do.
I mean, I can see a situation where I won't want my parents to know something, but I think even though I won't want them to know, I think they should. And I'd want to be able to make that decision with my parents because they do know more about me than maybe I know. And I'd want them involved in my decision because I think they should make that until we're of legal age to make it ourselves.
My sense on many clinics is that, and from what people tell me and in reports, there was a survey done of a number of, on the issue of abortion, which I think is somewhat related to this issue. By and large, the clinics covered up for the kids. And I think, frankly, that's my perspective on what goes on in a lot of these clinics is they don't want to engage the parents or bring the parents in, that the reflex action is to exclude parents from being involved by saying, oh no, you don't have to tell your parents. And I think that's probably in my view, majority case. That's the norm rather than the exception.
We give kids factual information, and there's been many times where young men and young women have came into the clinic here and said, okay, I can't tell my mom about this, I can't tell my dad about this, and I said, okay, let's find ways so you can do that. And we've made ways to make the information available to the parents, how to communicate with that parent. Sometimes I come in as an advocate. Sometimes I just give the kids a tool to talk to the parent. And other times I have parents who call me and say, hey, Mom, I got this 14-year-old little boy. He's been in 45 minutes in the bathroom. I know he's growing up. How do I have this conversation with him?
Walking Counseling Center was founded in 1969, and we were trying to serve alienated young people for the most part. We were together with Teenage Medical Service, and we were dealing with runaways and kids that were having trouble dealing with their families, or kids that were literally away from home seeking medical care or counseling or help. And the whole question was, could we serve them legally?
But our laws did not permit minors to go in and get health care without parental involvement or parental consent. And it wasn't that the law in Minnesota was specific. It wasn't. It was silent. So what we ended up having to do was try to write a law that would enable physicians, hospitals, clinics, whatever, to treat minors without parental consent, with no threat of lawsuit or anything.
We were coming out of the 60s. We were, don't trust anybody over 30. Even though the legislature, if you think about it, it was all men. The Minnesota Senate was entirely men. and they mostly were older men. And those older men in the 70s were persuaded that adolescents should have some window of opportunity to make their own decisions in their healthcare arena. So if you sort of think back to where we were, but in the times, the political times, you know, it was just before the Watergate era, and we were still in Vietnam, and we were still in the 60s of a lot of emancipation movements, you know, and so the minors piece probably fit in there. The civil rights movement, the women's rights movement. All these things happened in the context of the political times. The political times are much different now. We're a more conservative nation politically.
The world is changing, and the view of the rights of young people is changing. And the fact that young people, by law, statute, and regulation, do have access to health services on a confidential basis is not a threat and does not erode that kind of parental love and involvement with children.
Although they're aware of minors' consent, many of the people we work with are peer educators who are off talking to their peers about sexuality issues and chemical dependency issues and letting them know where they can go for services. They still don't see it as a political issue. They don't realize that lawmakers are talking about their lives at the state capitol, and they especially don't realize how disconnected the people who are bringing this up are from what their day-to-day reality is like.
Minors, by definition, do not have the judgment that we expect of adults. By definition, we don't let them enter into contracts. By definition, we don't hold them to the legal standards of adults. And yet, under the current state of the law, if they're alcohol or substance impaired, we emancipate them for purposes of making treatment decisions. This makes no sense.
To take children and to give them this kind of authority and to treat them as adults in this area is wrong. We are saying that when it comes to sex, drug, and alcohol, there are no children. You can be an adult and have the same rights and privileges as adults. It is counterproductive, it is destructive, and it is harmful.
There are many misperceptions, and a lot of them have come up today, a lot of fears around this issue. And what I'm afraid is that this bill would allow these fears and misperceptions to guide our policy making instead of using some sound medical practice. It's easy to forget that when we were talking about allowing youth in the community to access these services, we're not just referring to family planning services. We're referring to the ability of teens to receive services and information related to prenatal care, to chemical dependency, to the treatment of sexually transmitted diseases, and to some mental health concerns. And our hope is that it will act as a door to initially get some services needed so they won't be delayed, and in the process encourage parents to be involved.
Without the ability to see youth confidentially, they will silently try to cope with these huge issues alone. The result is depression, sudden decrease in school grades, often shoplifting as a sign for health, a loss of sexual boundaries, decreased self-esteem, untreated sexually transmitted infections, possibly suicide.
I think that once you explain this issue, even to parents who, maybe aren't as familiar with the law, there's an initial resistance, like, well, my teen can come to me, my child can talk to me, and that may very well be true. Probably is, but there's also some of that reality of being a teenager, where it's just that my mom and dad aren't cool, my mom and dad wouldn't understand, even though they might. It's very typical for a teenager not to necessarily see their parents that way. And I think that when you point that out to most parents, actually I know it is from having conversations with parents, that if this happens to be a phase that you're going through with your teenager where they just don't believe they can talk to you and they face something really tough, would you rather have them go to a friend in the locker room, or would you rather have them go to a professional?
A lot of kids are unknowledgeable. Again, and at this age in development, they get most of the information from their friends. Their friend is their parent. That's the best source of information, because they see their friend as an equal, and they take their word to be, the strong, valid, and so that's where they get the information from. And so if the friend's information is wrong, then your information is wrong, and that's passed down, then we have a whole bunch of uneducated, unknowledgeable kids running around here who can't come get information from me because he has to get a parent's consent to come see me first.
I think lots of folks in the inner city are seeing teenagers having babies. It's not the answer, and just handing out contraceptives is not the solution to that. It's at a deeper level of understanding sexuality and love and commitment and those things. It's not. I think the problem is sometimes we're dealing with sexuality in isolation as just kind of a physical act, but it's an engagement of one's whole person, one's whole being. And when you give that to somebody on a one-night stand, I think you've given away a part of yourself. And I think there's a lot of emotional damage and hurt that people carry around with them the rest of their lives, saying, I really regret that. I gave away a part of myself. And unfortunately, I think this law perpetuates the notion that, you know, hey, if you want to be sexually active, we'll let you decide, and we'll enable you, we'll support you in that by not only keeping your parents out of the loop, but by giving you contraceptives and whatever else you need to continue in that activity. And I think that's just devastating for a lot of these kids. And so I think the law fundamentally is not helping kids. It's going the other direction.
What kind of message are we sending? Is sex bad? You know, are we making it so that sex is a bad thing? The way we talk about it and the way we teach about it, sometimes it's that it's so bad, and they need to know that sex is wonderful. It's a beautiful thing. It feels good. But with sex comes responsibility, and you can create life by having sex, and that all of the things that they need to know, that we need to teach them so that they can put being sexually active in proper perspective. But if we're not talking about it in a good, healthy, positive way, it's like...
Kids are faced with sex all the time, every day, dozens of times. Their friends are bringing it up. They see it in ads. They see it on TV. I mean, maybe that says something about the world, but you can't get away from it. You can't take away all of those things out of, you can't just pluck that out of a teen's life. So they're faced with sex. They're thinking about sex. There are hormones raging. They're going to do it eventually. And they need to be able to do that in a safe way.
I think the conversation needs to be about consequences of early sexual debut. I mean, what we have had so far is abstinence versus safe sex. Nobody's talking about what are the consequences of sexual debut. Not how do we, but let's just talk about what we're seeing in our young people's lives. Let's talk about why is it in the past 30 years that we've seen adolescent suicide quadruple? Why is it that we've seen psychiatric illness among adolescents? Why are our kids feeling so disconnected? What is going on in our young people's lives that, has the world really become that unsafe a place?
I think that there has been, in certain circles, particularly through websites and other forms of communication, a number of themes that have been repeated over and over and over again. They're not based on the evidence. Some of them outright are not true. But if things are repeated often enough, and by what are seen as credible sources, people will believe them. And people have been told by opponents of the rights of adolescents that access to health services on a confidential basis constitutes an erosion of parental authority. I think what that has done is to set up some barriers to an open and compassionate conversation that really needs to happen so that these misconceptions can be cleared up. I think that what is driving it predominantly is fear, and the fear is not grounded in reality.
I think my perspective is, my view of sexuality is that it's intended, the purpose of it is for a marriage relationship. Obviously, many people don't agree with that, but I think fundamentally that's where sexuality expression should occur. And I think through the 60s and 70s, the sexual revolution basically said there are really no limits. There are very few limits on sexual expression. And I think the consequences of that have been pretty disastrous in terms of out-of-wedlock births, sexually transmitted disease, abortion. I view poverty as an outgrowth of that. All sorts of social pathologies and problems have resulted from a misuse of sexuality. And I think probably people are starting to say, yeah, we maybe have gone too far. The effort of government to step in and to deal with problems sometimes, frankly, makes things worse. Government cannot be ultimately a parent for a child, and yet that's what we're, in some respects, asking or allowing the medical community or social workers or others to do. They're stepping in and being the parent, and in the long run, I think that undermines families, especially when you have a law which applies to all families.
So those parents who believe that when young people have access to confidential care, that this somehow erodes their rights as parents, I think are really missing the point. We have other studies out of Minnesota, studies out of Massachusetts, that indicate that mandatory parental involvement laws, in fact, pose a significant barrier to the utilization of health services. Now, those who are critical of those studies often say that mandatory parental involvement laws, in fact, enhance communication between young people and their parents. We know definitively that this is not the case. We know from a variety of studies, both in the US and around the world, that the majority of young people do notify one or both parents, whether we're talking about abortion, whether we're talking about other reproductive health services, or just the utilization of health services in general. Most young people will talk to one or both parents, and virtually all young people will speak with another trusted adult if they cannot or will not confide in parents. So I wonder, what is this fear about? What is this anxiety about? Do we not want our children to develop in a safe and healthy way?
We know that kids are just being bombarded with stress and with information and the sexualization of youth on, in the media, and just so much stimuli that they take in. And I mean, and parents, both parents are at work, and we know that everybody is stretched thin. So this minor's consent is really a way for there to be sort of a safety net if a kid really feels like they're in trouble and seeks out care from a doctor or some kind of healthcare social provider, that they can go do that and they'll be protected.
So that tension between wanting to know and wanting to be involved, which is a good intention, will always be there. The truth that kids will always try something out that maybe they shouldn't, or that they'll get involved in something that they know their parents, don't agree with, I think that tension is always there too. We can't get rid of either one of those. And that minor consent is a wonderful compromise between giving good advice, giving good counsel to our teens, and at the other hand, offering them a way to come in with confidentiality and get good care and good treatment.
Kind of perspective, I think implicit, is that we know better what your child needs than you do as a parent. And that's kind of galling to many parents to realize that somebody with a PhD, somehow that makes them more qualified than me as a parent to raise my child. I think that's where a lot of the conflict comes in, because I think there is a perspective that it's the village raises the child. Well, ultimately, no, it's the parent that has to raise the child, because they have the most direct, ongoing personal contact. Now, are there exceptions to that? Sure, there are bad parents.
We really have to start to wonder, is it a good idea to mandate parental involvement when in fact the research is showing us that adolescents who choose not to notify parents in fact have substantially good reasons not to do so. This fear that youth will make very important health decisions without adult input simply is unfounded. And those who support that idea or propose that idea, I think, are either misleading us or are simply not well schooled in the data and in the evidence.
I don't think anyone's trying to make life harder for the teens. I think they're doing what they really feel is best for the teens. And I think everybody who's trying to do that, and I know that's life, but they do need to remember at the heart of it is the teens. And I feel like sometimes people just get really caught up in the debate as opposed to the heart of the issue. It's about teens. And so yes, I do think that they should have teen views being involved and being reported to the legislature, and teens going and testifying in the committees and stuff, and all the different steps into getting a bill passed. But if that's not going to happen, then the adults themselves need to look for the gray area.
I think that right now and into the future, the prospects for passing of a very restrictive bill is not good. I think that there are enough clear voices out there coming not only from parents, but also coming from practitioners and from educators that will really help our legislators to understand that placing undue restrictions on access to health services is a hindrance, it is a harm, it is not a help.
If it were repealed, we will have minors who have mental health problems who will not go in and get services. We will probably have an uptick in teen pregnancies because, as I said earlier, people don't really want to talk about their private sexual behavior, with certainly adolescents don't want to talk to their parents about it. We may see an increase in abortions.
We will realize if we take away this protection from our youth, this enfranchisement from our youth, this enabling piece of public policy from our youth 2 sessions out, in 12 months, 18 months, we will realize we have made a tremendous mistake. We've created an island in America where kids are denied care. We have created an island where it's okay for mom and dad, mostly dad, to say, I'll take care of that little alcoholic. I'll take care of that little sexually active guy. And that didn't work 3 generations ago. And it isn't going to work 2 legislative sessions out. Were we to be foolish enough to repeal that, we'll put it back again. And we'll put it back 2 legislative sessions from the time it is repealed. But in the intervening years, damage will have been done. And I don't think that's the job of Minnesota government, to create damage for its citizens. I don't think it's going to be repealed.
The challenge remains for us to engage both points of view in a respectful dialogue that results in sound public health policy that benefits adolescents and society.